Hello, my name is Aljosa Trmcic and welcome back to another round of coronavirus boosters. As you probably noticed, we switched to having these updates every second week. So this would be a coronavirus booster for the week of April 12th. First, the numbers. The numbers are not very promising. The numbers are still high, and basically we made no progress in reducing the numbers in the last month and a half. Michigan is reporting numbers that are close to all-time high. They're reporting almost seven-fold increase in cases since late February. If Michigan trends start to happen across country, we might need to implement some major restrictions again. So before something like this happens, we have to stop and think for a moment. Each of us has to be aware of the risk during each step of our daily lives. If states are reopening, if restaurants are reopening, if birthdays and weddings are on our calendars again, this doesn't mean that the risk is gone and that we're back to how things were before the pandemic. So each of us should still avoid any large gatherings, especially indoor. Choose takeout over eating inside a restaurant. Avoid situations where you're not able to maintain your social distancing or where people around you refuse to keep their distance or wear their face coverings. So this is nothing personal, this is just good practice. One part of the statistics that's really promising is the number of deaths, which has been on constant decline since mid-January. Part of it is because we have good testing programs across nation that are able to identify new cases early on. We are much better at treating the disease than we were a year ago. And finally, our focus on first vaccinating most sensitive part of the population is also playing a role now. For example, 60% of the population above the age of 65 is now fully vaccinated, and almost 80% of them received at least one dose. The next step is to get this part of the population fully vaccinated and continue with the rest of the population. New York State already opened vaccination to anybody working or studying that's of age 16 and above. And it looks like other states might do the same by April 19th. Currently, we have 21% of the population fully vaccinated. We don't have exact percentages for COVID, but from other viral diseases, we know that we need at least 70 to 80% of the population vaccinated in order to achieve herd immunity. And this will take time to achieve, even if everything else from the supply end runs smoothly. What we can do is get vaccinated without hesitation. As soon as vaccine is available to us, we should get it regardless of the type of vaccine we're getting, because all three vaccines that are currently approved in the US are both safe and effective. If there's any doubts, CDC has some really good resources on vaccinations, including why it is important to keep wearing face coverings, why it is important to practice social distancing, and keep washing our hands even after we are fully vaccinated. We also covered different aspects of vaccines in our previous coronavirus boosters, both general and food industry related. For example, I would refer you to our last coronavirus booster from the week of March 29, where Anika Jan40 and Kieran Ospina give some really good advice on how to best approach vaccinating food industry workers. One update I wanted to mention this week is CDC's updated guidelines on how frequently you should clean and sanitize your frequently touched surfaces, which are now more in line with the general agreement that contaminated surfaces are not a major risk. How do we know this? Well, first of all, we know the virus is not very stable outside of the host. So SARS-CoV-2, the virus that causes COVID-19, has a specific structure with this fat layer on the surface, which is very fragile and different than the structure of some viruses that we know are able to survive for a long time outside of the host, for example, norovirus. So contaminated surfaces are not a risk, but you still have to keep washing your hands and you have to keep avoiding touching your face. Now you're probably thinking, what am I going to do with all the time and energy that I used to invest into frequently cleaning my frequently touched surfaces? Well, what you could do is take one of our info sheets on how to prioritize COVID-19 control strategies, and you can go from top to the bottom and reevaluate each step. How ready are you for vaccination of your workers? Is social distancing being followed? Are face coverings being worn over mouth and nose? How good is your screening? And so on. For example, with warm weather coming in, states opening up, and just the general desire from all of us to go back to normal, we can expect the compliance with social distancing and face coverings to go down. And similar trend we can expect to come into our production and processing facilities. So maybe a good investment would be to reevaluate your verification procedures, the ones that are making sure the main control strategies are being followed. So there are a number of different technologies that were developed for this purpose, but something as simple as, production manager taking 2 times a shift, 30 minutes to go on the floor and just observe, are workers following social distancing? Are they wearing face coverings? Just make short-term corrections and hopefully long-term improvements. So with this, I will finish as always with our basic control strategies infographic and say that this work is supported by USDA NIFA grant and brought to you by Cornell's Institute for Food Safety. Thank you very much and stay safe.